Good morning, everyone. How you doing? And just to introduce myself, I'm Abdul, Head of Environment and Sustainability at Middlesex University. And today we're launching our second SDG webinar. So we launched our first on the 28th of November, and now we are doing a follow-up on good health and well-being. And what I wanted to do today is just to catch up and see what we're doing at the university, whether you're attending Middlesex or not. This is going to be a great lineup today. So without further ado, I've got an opening question for all of our panels, and I'm going to let them introduce themselves. But the opening question for our panelists today is, what does good health and well-being mean to you? And I'll allow Lisa to introduce herself.
Hi, thank you. So my name is Lisa Marzano. I'm a professor of psychology. I've been at Middlesex for a very, very long time. I was a student back in '98. David was my lecturer at the time. And now I'm a professor, but also I'm a theme director for equity and improvements in health and wellbeing. So I'm sure this will come up as part of our discussion, but I've had the great opportunity over the last maybe about a year and a half now, to get involved and trying to stimulate some of the great work that we're doing across our teaching, research and knowledge exchange to try and bring about equity and improvements in health and well-being. So what does it mean to me? I'm going to try and be as short as I can, because obviously it's a big question. I think good health and well-being is holistic, but in the true sense of holistic. So I think we've got to be holistic in how we sort of define actually what health is. You know, there's a lot of discussion about not forgetting mental health, and it's not just about physical health, but I think it goes beyond that. It's about spiritual health, it's about financial health, social health, environmental health. So it's really trying to sort of bring it away from just the focus on the individual to the broader context, structures and inequalities where we operate. So part of that is also understanding that the causes are holistic and the causes are complex. So I'm really interested in the sort of discussion on the so-called social determinants of health. So the conditions in which people are born, in which they grow, in which they then come to work or not, and how we age. And that sort of kind of economics and social context is really important. There was a report just coming out a few days ago from the UCL Centre of Health Equity showing that over 1 million lives were lost in England as a result, additional lives, if you want, as a result of kind of inequalities in health. So I think that's got to be an important part of the picture. And then, of course, we've got to be holistic in how we think about solutions, and we've got to really think about understanding the sort of the complexities and collaborative partnership, interdisciplinary approaches, if we're thinking about sort of the academic context of it, and addressing that. So I think good health is equitable health. It's health, you know, as the UN says, health for all at all ages, and it has to be truly so. I live in a borough where women on the sort of rich side of the borough live on average 17 years longer than women on the poor side of the borough. And I think that's shocking. And I think that's the sort of thing where I think through our research, through the work that we do, through our teaching, I'd really like to try and address. Yeah, I'll stop there.
Yeah, that's a great opening statement. So hopefully if you want to post questions to Lisa, which I will do later on, please put them in the chat. But there's a lot of things just to pick out there, because I think making those changes, there's a number of things that you have to tackle. And I think education is certainly comes out as something really, really important there, Lisa. So don't forget to put your questions in the chat. But Nicky, as well, what's your response to the question?
Apart from agreeing with everything that's just been said and wondering what else there is left to say, I pity the people that are going to go last on this. My name's Nicky Lambert. I'm a mental health nurse. I've been for many, many years, and I'm an associate professor at Middlesex in the Department of Mental Health and Social Work. I do a lot of work with sort of women's wellbeing in the community, so I'm involved in that type of thing, and community building and resilience is very important to me. But I think when we're talking about good health and wellbeing, for me, what it means is that people have the freedom and ability to access resources fairly. And I think a lot of what Lisa was talking about in terms of social justice really, really does absolutely chime with my experience of health, which has changed a lot over the last 20, 30 30 years, in that I first started off very much with an idea that health was, in hospitals, and this is how we did it, and that's what that meant. And actually, we see people at the point when they come into hospital and they need us in terms of physical or mental health, but actually the seeds of illness are sown way before that. And it's a lot to do with the way that we treat each other and the expectations we have of our society. And I think we can create a healthier society. And it's very easy to imagine that power is outside of our hands, but we create society by the choices that we make and the things that we value and prioritize. And we can make different choices, and we can prioritize different things, and we can live in ways that are better, more harmonious for our environment, and kinder and better for each other. But we need to change our priorities. And I think one of the things that the goals give us, the Sustainable Development Goals give us, is a pattern or a thing to work to, and to consider much more broadly how we're going to live and what we're going to do in the future, because what we're doing now isn't working. So that's what I would say about health and wellbeing.
There's a lot there packed. So again, hopefully those will have questions for Nicky, but things that came out, again, women. I think that's quite clear. Women have had challenges in the past, but one of the things that came out clear to me already is that prevention is better than cure, and I think that's one thing that we have to work on. When you think about the challenges that nurses are going through, and we have a good teaching program and that at Middlesex,
Yeah,
and that's really hopefully going to come across in our discussion. So Suhaib, over to you. I know it's a bit daunting, but make an introduction, and yeah, let's hear from yourself.
Hi, good morning, everyone. So my name is Suhaib. I'm currently a student of international relations, politics, and law, and I'm interested in sort of mental health, and so that's why I'm attending this webinar. So for me, in terms of the question of what this good well-being means, is like, as Nikki said, like, every person gets the or has the access to resources for their own health, So it can be like, access to emergencies, access to mental health. So, and access, and I would say quality as well, because I think so sometimes we do have access, but the quality that we get from that access is not that, it doesn't match the level that it should. So I think so in terms of what good well-being or good health for me is like, I'm having that quality access to services. And secondly, I would say like, as many as before my one of the panelists told, like, it depends like a lot on our approach to it, like, what does good well-being means for us, So it can be like, if you're financially stable, that might lead to us being good well-being or good health, or if you're emotionally stable. So I think so it depends. It also depends on each and everyone's case, like, for them good health can be like, they're free from work, or not like that sort of pressure from work, or they're financially stable, so that leads to the good well-being. So I also think so like it depends on each and every case, but like generally I would say like it totally depends, like, on the access and the quality of the resources that you get. I hope I answered it.
No, that's great. And one of the reasons why I invite Suhaib here is a student at Middlesex University, and it's important to give them access, give them a voice, because I think that's one of the key things that Suhaib has really highlighted just from his opening statement. People being able to get access to support, access to actually have better, mental health, access to be able to educate, access to be able to develop themselves. And that has really come across. So if you've got any questions for Suhaib as well, please, again, think about that, and we could put that in the chat. Last but not least, David, same question to yourself. The challenges is that we've had some great opening statements from this, but over to you, David.
Okay, thanks, Robin. Hello, everyone. My name's David Westley. I'm the head of Department of Psychology at Middlesex University. And wow, tough acts to follow. I completely agree with what everyone has said about social justice, and really that is the key thing that underpins our well-being. Perhaps I'd just add one thing to that, which I think is fundamental. It's implied in what people have already said. And it's really about kindness, which is the fuel that fuels social connection, which fuels positive mental health. And I guess in sort of Western cultures, we can get preoccupied with a sense of what makes people individual. Nothing wrong with that necessarily, but it does make things like mental health and well-being look like they are solo projects. I think from everything we've heard so far, we can hear that that's not the case. It's the case that good mental health is good social connection and equity of opportunity. Kindness is the thing that can get that going in sort of opposition to a culture of competition and everyone finding their own way.
Brilliant, David. And I think kindness is certainly important. And well, I'm going to add my thing, my prerogative as a chair that I can add. I think I want to add on to what you said. I want to say compassion. Compassion for yourself and compassion for others. I think that's really important to build upon, really. And I just thought I'd throw that in there. But look, hopefully letting everyone know this is a recording, just a reminder, but put your questions in chat. But Lisa, I want to just continue this kind of conversation that we're having. So the first question I have is, as a theme director, can you provide an overview of the university's approach to promoting equity and health for good health and well-being?
Gosh, yes. We do. Well, I probably would say that, wouldn't I? I think we do quite a lot in terms of for our students. I think there's some great activity going on from the sort of student health and well-being side of things. There'll be a fair in the quad actually tomorrow, and I think that'll be a nice opportunity to sort of showcase some of the activities that are going on, including with external partners. And I think we've got good support for our students, we've got good support for our staff. I think we're classed as a sort of healthy campus and healthy university. And my work actually sits a bit outside that. I mean, of course, in collaboration with the people who are doing this great work. And it's more at the level of our research and knowledge exchange and how we bring that into some of our teaching. And there are sort of lots of examples I could draw on of the kind of work that we do in communities with communities to sort of support people's well-being and different aspects of health. And that very much spans from community interventions where we bring people together and we show the benefits of dance and exercise and being in nature. So there's some sort of great activities like that, all the way to sort of a kind of scientists in our kind of natural science department doing work on nanotechnologies and pharmaceuticals and using machine learning to improve diagnostics for particular types of cancers. So I think there's a lot that we do. One example, because it's hard, I don't want to sort of exclude anybody, but one example that I'm really excited about came out of this event we ran last year, this knowledge into action with it, at the heart of our university strategy is the idea that we have this sort of create this knowledge, but also are keen to put it into action. And we had a provocation from a community group working in Haringey, Public Voice, who told us about some of the problems that they have. And one of them was around inequalities in maternity care. And a kind of part of our response was actually two colleagues coming together, one saying, okay, it seems like one of the barriers is around language. I teach English as a foreign language, and I can develop syllabus to help women for whom English isn't the first language, so they can have an antenatal course that's better designed for those needs. And she came together with another colleague who's a midwife. And really developing in partnership. And this is something that hopefully, is growing and will continue to grow. And there'll be some sort of co-production, and with women themselves and thinking about what their needs are. And maybe just one example, I can think of many, and I know there are people here in the room as well that are doing great work. But I just think it's a nice example of really collaborative, interdisciplinary, and also having sort of co-production and having the people who will benefit from this health at the heart of these activities and interventions.
I think that's a really great targeted example. And for me, one of the clear things is that I think communication is quite important on how we work on these things. And Nicky, I want to bring you into this kind of conversation as well, because and leading on to what Lisa was saying, because she gave a fantastic example, but How do communities build on collective mental health resilience, in your opinion?
I think it's a big question, isn't it? Because we see some communities having a very different time of it. And I think if you look at things like the Public Health England fingertip searches, they are really interesting. For example, in London, one of the things you'll see is how disparate people's experience is, exactly as Lisa was saying, across one side of a borough to the next. So the borough that complains the most about air quality is I think Richmond on Thames, something like that. And that's obviously not the borough with the worst air condition. So I think there's a lot to be said about how people see their rights as well. And I think part of health needs to be about supporting people to access complaint systems, because one of the big issues, I think, is that we don't take enough of a kind of communal view of health. We very much look at things. I think a classic example is resilience, particularly in the workplace. You see this all the time. I think Michael Trainer did a lot of work around this, talking about resilience being very much placed in the individual. Like, can you cope with your workload? Can you manage? Can you manage your own health? What are you doing about relaxing? Instead of thinking, are you trying to live or work in a system that's not set up to promote your well-being and health? In fact, that's set up to completely disregard your well-being and health. You know, and it's no accident when we look at things like air quality, the first person to die of poor air quality in London, that was found in 2020 to be a 8-year-old Black girl in South London. That's not an accident. You know, yes, she had asthma. So, you know, the air quality around her was very poor. The people around her didn't have access to complaint in the same way that people in richer areas do. And that happened. And it still happens, and it happens all the time. And part of that, you know, I think as Suhaib was saying, it's not just about do you have access, but it's do you have the resources to actually do something about things? Because there are populations that are chock full of lawyers and people who have social capital, people who can make change happen because they understand how the system works. And they don't get, you know, big roads straight through the front of their houses. They have more access to green space, which, as Lisa pointed out, is so important for people's well-being. It's, I think, part of our tackling health and well-being has to be a little bit political now. We've got to the stage where we've smiled and tried to do better, and that's not going to work anymore. You know, we've come to a situation, I think, where we do need to be a bit more radical about how we think about protecting and promoting people. Another thing that Lisa brought up that was so important as well was co-production. In the past, when we've tried to fix things, we've sometimes had to step away from the people who we're trying to help, and we've helped at them instead of actually asking them what they need, what works for them. And I think the growth of co-production, and it's kind of making it more of a central way of working. So by co-production, what I mean is that everybody involved actually genuinely talks about what the problem is, and everybody involved starts to move towards solutions together. And we're doing things with people and not to them. You know, you can't do health to people. You know, health is something that you create with them. So those are the things that I would say.
Oh wow, I think I mean totally agree
You've
with
set me
you.
off, Rabin. What can I tell you?
Yeah, no, and that's what I'm here for. And you've kind of set me off as well, because I worked in wellbeing, and one of the things that was really important as a wellbeing lead for a government department is that people need the right environment. And when we look at the SDGs and we're trying to carry out the climate environment, which I've worked on as well, people need to be in a good health and well-being space. They need that right environment. They need that right environment to thrive. They need that right environment to add to the community. And you've really brought that out. So hopefully we're definitely going to be bringing this theme out in this conversation. But you hit some really good points, and I totally agree with you. So yeah, but I want to bring you into this because before we continue on other themes, but as a student, right, how do you prioritize your mental health and well-being? Because obviously you've heard a lot what the panel have said, but how does that work for you as a student?
Yeah, I think for students it's really important, like, because a lot of students do study and work at the same time. So it's like very important, like, you manage your workload. And I think that's the first thing is that you need to manage your workload, like in terms of your mental health, because if you do a lot, your mental health is going to get affected. So I think so managing a workload in a time frame that works for you is the first step, for ensuring that you're mentally stable. And the second I would say is, like, slow down. There's nothing wrong in slowing down in certain phases. Because I think so we have been taught this hustle culture, like especially in London, there's so much hustle around you, and then you think like you're not doing anything because the others people are doing a lot, and then you just get this in this like I would say state like you're doing nothing, you're gonna work hard, which is all right. There's no like harm in working hard, but I think so it shouldn't be at the cost of your mental health. Um, definitely. So, I think so you should slow down in certain phases, like when you feel like you're not doing mentally well, because if you're not mentally well, your work is not the work that you're going to work on, it's not going to be good. I think that's the relationship that I think of. And thirdly is like, I would say go out, because I think so a lot of us like, just stay in because we're going to work. But I think so you gotta give yourself a rest and go out, explore. So I think so these like 3 steps I would recommend to any student who's finding difficult, in managing their mental health, especially.
I think you raised a series of great points there, and it's one of the points that resonated with me. When you think about this, and I'm using a very crude example, but I spend about a good 10 minutes a day on my dental health. But what about our mental health? And think about, something like the teeth, dental health, we do that easily every day. But sometimes we have to think about our mental health, and mental health is a spectrum, and it's something that we can't ignore. And you definitely, if you're as a student have a heavy workload, I'd always say you need to factor in relaxation. I think that's a really, really important point. And again, hopefully those audience members can ask these kind of questions if they want to a panel, but that is a really key point I think that you've raised. But I did want to continue the theme on climate change a bit as well. And David, I wanted to ask you this. When tackling climate change, how does well-being, in your opinion, come into the equation?
Gosh, so that's a big question. I guess the first thing to say is that climate change anxiety is a thing. It's a very real thing. People are worried about what climate change is going to mean for their future in places like the UK, but across the world, climate change is already changing people's material and social circumstances. So I think we've already heard Lisa, Nicky, and Suhaib talk about the kind of social context of things, and climate change will change that context for people, and that's how it's going to affect people's mental health. And that's not even considering things like the extreme weather events that seem to be connected to climate change, which will have potentially traumatic impacts on individuals. Again, this is a problem that we can only tackle at a holistic level. It's not, although individual choices might make a difference, this takes coordinated action to I suppose, reconceive the way that we construct and support our communities.
I think that's a really, really great point, and it is about supporting the communities, and I think that's one of the things that's probably going to be discussed today, and probably leads on. I want to bring Lisa back into this because when we talk about how support is needed, one of the elephants in the room is what about the barriers and challenges? And as a theme director, can I ask you, like, what are the barriers and challenges that the university have in promoting equity in good health and well-being?
It's funny, when we sort of go back to the earlier point about workloads, don't we? I think at the moment everybody's feeling a little bit stretched. Financial stretch means that it's putting a stretch on people's time and creating some pressures, and maybe we don't need to start talking about accelerated change programs, but certainly the sort of wider context creates some barriers to sort of being able to kind of focus on the things that we'd like to be focusing on. I think there are some absolutely great people at Middlesex and some great colleagues and students and lots of like-minded people who want this work to continue, so I can't imagine that it won't. But it's certainly, if we're realistic, outside pressures in any ecosystem create some some barriers. So I think that issue around, it was interesting, you know, from a student's perspective, but also from a kind of staff perspective, you know, at the time and how we manage our time and what pressures and expectations we put on our time and what's feasible clearly is has an impact on all these things. Actually made me think as you were talking, sorry to sort of go a bit off the question in a way, and link back to what was said. There was a brilliant book I read that was called 4,000 Weeks. And I don't know if you've come across it. It's Oliver, oh God, I'm terrible with names, Berkman, I think. He used to be a Guardian columnist and a sort of time management guru, and basically tried a million, the Pomodoro technique, lots of different time management techniques, you know, the people who schedule their day in 20-minute appointments, and the people who have a zero inbox, and the people who do this and people who do that. And then in the end, he realized that the solution is just accepting and appreciating that time is finite and you're not going to be able to do all the things that you want to do. And you've got to make some decisions and live happy with that. And it's really made a difference to how I sort of see some of these things sometimes that, anyway, sorry, that's going off the point, but it's an important reminder of, not putting too much pressure on ourselves and what we can achieve at particular times, and sort of keep working together, maybe prioritizing what we want to focus on. And of course, I would say that as theme director for this particular themes, I certainly don't think we should abandon any of the good work that we're doing in terms of health and wellbeing across the spectrum.
I'm so glad that I've done this webinar this morning, because I think acceptance is something that we do need, isn't it? Really, we do need to have that acceptance to sometimes think that we cannot do this and accept it. And I think that's a really, really great point. So thank you for that as well. Nicky, I did want to bring you back into a conversation, because I'm sure a lot of these conversation is fueling your thoughts. But how do you improve access to support, to give support to those seeking to address things like mental health issues then? Because that's one of the challenges that's clear that we've discussed. But how do you improve the access to that?
Well, I think it's been a very interesting sort of last 10, 15 years. There's been a lot of work done, around time to change, around destigmatizing mental distress. And one of the things that's really interestingly happened is that services have become totally overwhelmed. As soon as people were able to actually think, perhaps what I'm experiencing is depression, or perhaps I'm identifying anxiety here, people came forward to seek help. And obviously the services were set up primarily to deal with serious and enduring mental distress, rather than be necessarily great with having a lot of access to talking therapies and ways that we can manage our everyday experience. And we're seeing some really interesting things in society around a blurring of the boundaries between health and psychology and well-being and kind of everyday language. So you'll see a lot of psychological terms inappropriately being used in everyday language, including, and I would say maybe even stigmatizing, some of the distress that people feel. And I think the biggest issue is to remember that nobody would expect to get through their life without bumps, bruises, flu, maybe breaking an arm or leg. And that's normal. That's the spectrum of physical health. And we all understand that if you are going to fully engage with life, you can have a few lumps taken out of you. That's probably what's going to happen. And I think the same is true of mental health as well. There are times in your life where you have your heart broken, where your hopes and dreams disappear. In the same way, there are times in your life when you're ecstatic. Maybe you fall in love, you have a passion for a project or something which really lifts you. And that's all part of the human experience. The human experience is not to be in a weird state of disconnected happiness and satisfaction forever. The human experience, for me, is about winning and losing and connecting and loving and crying and moving forward and getting stronger, and sometimes being the windshield and sometimes being the bug, and having people around you who can support you. It's a changing state, and a state where we grow and connect and learn. It doesn't necessarily mean that it's a painless state. And I think, if you are going to live a full life, then that's part of the expectation that you have to have. Disconnected, weird, happiness is something people use to sell you trainers. It's not real. Somebody's put in the, I think Ramnik has put in the questions about social media, and that I think ties up with it as well. So in the past, we compared ourselves with a small group of people. Now we compare ourselves with an unrealistic projection of everybody in the world. And I think it's natural that we sometimes struggle with satisfaction, with self-image, when the things that we're trying to become aren't real. You know, even if you look at, people's selfies, when people are changing their faces, it's really hard for you to then decide where you fit in that pecking order. So there's lots going on, I think, in terms of happiness and health and well-being. And I think one of the things that you can do, just straight up, is to treat yourself with the kindness and compassion that you try and treat other people with. And I think one of the things, a trap that perhaps we all fall into, is we say things to ourselves about ourselves in our head that we wouldn't dream of saying to anybody else. Oh, you're not good enough, or you're rubbish at this, you'll never make it. And you think, I would never say that to another person. So why would I say it to myself? And I think Suhaib was talking about this, the hustle culture is really real as well. This idea that everybody else is being really productive all the time. I mean, I find the kind of January, let's stop drinking, get healthy, absolutely horrifying. This is a time for chatting with your mates, reading a good book and cuddling up. It's not a time for ploughing off and starting, a 6 a.m. run, unless that makes you happy. If that makes you happy, go be you. But this idea that, in the darkest, coldest, most difficult, financially restricted month, we should suddenly start to become our best selves. I struggle with that a little bit. Why don't you save it till the sun comes out, sort of like June-ish, and see how you do then? So being realistic, being kind and compassionate, I would say, are the things that will help you to be healthy. And the other thing is being critical about the idea of resilience as well. So yes, resilience is important, but resilience is something which fluctuates like happiness does. And you need to be in a situation where you can be supported. You can't take the weight of the world on your shoulders and systemic injustice and then wonder why you're not coping. So speak up, speak out, connect with other people, I would say, around those sorts of issues. I see, David, you've got your hand up. I've triggered you. Good.
Yeah, no, well, heated agreement. It was just that when you were talking about thinking about being as kind to yourself as to others, I just threw a link into the chat for some self-compassion exercises from Kristen Neff, who's written extensively about self-compassion. And the first exercise is, how would you treat a friend? It's very, very nice to kind of written exercises to try out.
Oh, brilliant. Well, I'm gonna be a bit off cuff here actually, and David, I wanna develop Ramnik's question here as well. So I want to ask you, in your experience, what role does self-image play in an individual's overall well-being?
How we think about ourselves is, I suppose, a lens for how we interpret what's going on around us. It's a guide to how we take in information, and what we pay attention to in this world is a crucial determinant of how we feel about our circumstances.
That's a very brilliant, outstanding response. And again, I still want to develop Ramnik's question on one further point. Suhaib, I want to bring you into this. You've heard of the panel speak, but you as a student, or maybe your peers, do you personally feel comfortable seeking help, talking about mental health issues with your peers, or even within the faculty? Why or why not?
I can say about myself that I do like I think so, I do feel quite confident like talking about my mental health with my colleagues and with the professors, because there is a sense of especially in Middlesex, like this sense of I would say privacy, they won't be telling everyone about the issues that you face, and then they'll understand your point of view. And of course, if they can't help, they will of course refer to someone who can help. So I think so that's really important, your workplace or your study place, that there's a sense of sort of community within that place, that that you can feel, and then you can go back whenever you need. I think that's a very important thing, that one should have that sense of community in any workplace or any university or school place. I think so it's really important we build that. And I think so secondly, it's also very important to encourage students, especially that it's okay if you seek help. There's nothing wrong with seeking help, because in some, unfortunately, there's this thing you got to handle everything by yourself. And I don't think so. I of course disagree with that, because I think so. You should always seek help whenever you need it, and there's nothing wrong with it. Like you shouldn't feel shy, and you should be and you shouldn't like feel like you're a loser or something like that, because everyone needs help. It can be mental health, it can be physical health, or it can be just a bit of emotional help. You're feeling low on a day in a day. You just need to talk, share your feelings with anyone, and I think so that should be normalized. And I think so. Unfortunately, it's sort of like it's we are like living, especially after pandemic. It's like such a lonely world that some people do live in, and they don't have the chance to share their feelings, which I think is not okay. So yeah, that's one.
Well, I wanna go a bit deeper as well,
Yeah,
Suhaib, as well. So when you think about students on campus, for example, what do you think are the challenges in related to what kind of challenges do they face?
So in terms of challenges, in terms of like,
Their mental health.
yeah, sure. So I think so in terms of challenges, it's like one of the challenges I can think is like going to the right place for the help. Because I think it's very important students actually know like where they can go for help. So I think that is one of the challenge that students do face, like where should they go. And secondly, I think so is the thing like about sort of like managing their schedules, like I've seen some students like they're so busy with the work and studies that they don't get time to seek help. So they just bury or just leave the feelings alone because they're busy, and then once they get back to it, it's sort of done or it's sort of gone. That sort of feelings that hurting them. I think so. As I said before, it's really important that you take time out for your own self, because at the end of the day, work does have eventually does happen, but your once your health it's not good, and you might of course you'll get affected by bad health, I would say. So yeah.
I think brilliant. Thank you for that, Suhaib, as well. At least I want to bring you back into this, and it's a difficult question I've probably got lined up for you, so apologies there. But I think one of the things is, as a university, we try and provide help. We try and create a better environment. But then, how does a university, in your role as theme director, then measure the impact of this initiative in promoting equality in health and well-being? I know that's a difficult question.
Well, at the moment, we use the good old indicators of REF, TEF, and KEF. I mean, that's why we're trying to bring it all together. So, as kind of theme directors, for example, we're doing a lot of work and thinking around, the work when we talk about the themes, whether it's equity and improvements in health and well-being, or the other two themes, sustainability of communities and the environment, and then we have a theme around culture and entrepreneurship. Really, we're talking about impact and impactful work, and I think part of sort of tying up the various activities that we do is try and tie up that with the sort of metrics that the outside world values and wants us to be able to speak the language of. So there's a lot of work at the moment thinking around the metrics of the REF, the Research Excellence Framework exercise, but also the KEF. And also there's a metric within the TEF, which is how we evaluate the quality of our teaching, that talks about the extent to which research sort of feeds into our teaching and informs our teaching. So sorry, probably a boring answer around.
No, I think no, but
about performance metrics and but I think that there's quite a bit of that work going on behind the scenes at the moment to think about our culture, our environment, and that means our research culture, but more generally our culture as an institution, the extent to which we are inclusive, the extent to which we value equality, diversity, inclusion, etc., are valued. So within that, I mean, I think that's important, but it's not losing sight of what we can do and some of the initiatives and the people, and that we don't get too lost in the language of metrics. So we've got, for example, I think a brilliant initiative going on at the moment to think around our graduation ceremonies and how to make sure that they're inclusive to people who struggle with conventional graduation ceremonies because of neurodiversity or other reasons. And we've been working with a group, including some students and colleagues with neurodiversity, to think about actually what would work and what can we change and what support we can give in the run-up to graduation on the day itself, not just for students, but also for family members or other guests and for staff themselves. You know, for some people, sitting in a room with, you know, 3 hours of clapping and lights in your face is absolutely hellish. So what can we do to ensure that those who want to be part of the experience are? So I think those sorts of things, you know, probably will end up being captured in some kind of metric. I think, you know, I think not everything, you know, we should still do good work that might or might not end up in the ref or the TEF or the KEF. But yeah, strictly speaking, that's how we do it. And of course, all the work that you're very familiar with in terms of the impact rankings and and that huge exercise of looking back retrospectively what 2 years prior, what sort of initiatives we were, you know, implementing towards the sustainable development goals. It's a lot of work, isn't it?
Oh yeah, and absolutely. And I think the reason why I asked that question, because I think it's really important as organizations, any organizations, universities, etc., that we're reflective, because it's really important that we're reflective and we have lessons learned. And yes, mistakes can be made, I'd always say, but let's reflect on that and put them in place. Nicky, I've got to bring you.
What Nicky said earlier, in a sense, it's also about being critical of resilience. You know, we talk a lot about resilience and critical of the things that we do. I mean, what I always think is, you know, let's think about some of the unintended consequences of, you know, very well-meaning initiatives or even ways of talking about certain things that actually don't work for all at all times. And it's important to create space to be critical, to reflect on that, to address those things. You know, when I'm not wearing my theme director hat, or well, in a way both, I do lots of work on suicide and self-harm prevention. That's my area of research, and we know that there are, you know, some, as I said, well-meaning initiatives to try and support people that actually can have unintended consequences, and those we need to learn, you know, what those are, and to make sure that we, you know, manage those risks as much as possible.
I think absolutely right, and it's something that Suhaib was saying as well. I think we need to make sure that we understand individuals as well, neurodiversity. That's really important. And Nicky, I do want to bring you into this, because what do you consider is the most pressing of issues or challenges that in healthcare today, you know, and how do you think they could be addressed? Because we have talked about reflection, but can you add to this debate as well?
Biggest problem in the UK, I think, at the moment, in terms of health impact, is poverty. People don't want to hear it, but it's true. I think austerity has done tremendous damage to our social functioning, our communities, particularly the most vulnerable. Everything from Sure Start centres to access to GPs, all of that has been impacted by choices that we've made as a group, as a country. And I think that they have led us into some quite frightening times. You know, I mean, the thought that we have children sleeping under coats in this country is absolutely unacceptable. You know, we can faff around the edges, you know, but we've all seen the explosion of food banks. You know, how can you be healthy if you can't have food, if you can't have enough heat in your house? You know, I think we need to be a lot more ambitious about what we want for health, because there's so much potential. And it's so easy, I think, whenever you're looking at a big problem, sort of a wicked problem, a complex problem, or a knotty or thorny problem, to think that this is the way it's always been and this is the way it's always going to be. And that's not true. It's not true. You know, the idea that people are sort of hopeless and helpless is not true. We can make decisions and choices all the time as individuals, as families, as groups, as communities, like we are at the university, in our local areas. You know, all those choices stack up to better living for everybody. So, you know, whenever you see things on the television, like I think the thing always blows my mind is when an MP, for example, opens a food bank. It's like, do you have any idea what your job is? Your job is not to preside over the decline of society. Your job is to make sure that we're living in happy, healthy, engaged communities. That's the point of like managing ourselves politically, isn't it? And making these group choices. But I think leaving it to people far away is equally a way of giving up. And I think when you look at some of the ways that university students have responded to the kind of difficulties that we've seen in our local communities, it's been really inspiring. And when you see the university being used as a hub for different communities to come together and try and hear each other and try and work with each other and try and understand each other. That to me is really important work that the university does, or facilitates even. And I think that's really, it's exciting. So for me, biggest problem is a shortage of healthcare staff. You know, we have seen a real decline in the numbers of people coming forward, and that's entirely linked to not paying nurses a bursary. So that was one of the things that happened in the last few years. For all students on arts culture courses who are having an absolutely difficult but amazing holidays, your health and wellbeing colleagues don't get that. They get a couple of weeks in the summer, a couple of weeks over Christmas, and they work half of their course for free in the NHS, and they have to pay to go to those shifts. The fact that they do that is something that we should all be grateful for. And as well, I think, having seen how our colleagues, particularly colleagues of colour, were treated during COVID, all the clapping in the world isn't going to pay their mortgages, you know, and all that kind of like describing sort of nurses and healthcare professionals and housekeepers in hospitals as like superheroes is really unhelpful. They're not superheroes. They're your mums and sisters and aunties and brothers, and they need PPE that works, and they need to be paid, and they need to be supported in their training. And if you want healthcare, then that's something that has to happen. And I think we need to be a lot more vocal about stuff like that. I mean, obviously I hold back, but I think you guys should talk up. So, I mean, those are the things I think that are important. You know, the way that we have expectations, I think, is the thing that's going to change how our health is over the next 10, 15 years. The other thing that David was talking about when he was talking about climate change, we are really underestimating the impact that's going to have on health. You know, migrant communities are going to be forced to be more migrant. You know, all that, if we carry on the way that we're going, there's going to be big parts of the earth that you can't really live in safely, and people are going to have to move, and we are going to see real problems with people fighting over resources. You know, it's an interesting disconnection that we've got politically and in terms of our health and society around climate change. You know, there are still some people who think that it just means it's going to rain a bit more or a bit less. No. This is a fight that you need to get involved in now if you want to preserve health and well-being, for sure. So I've thrown in a few more conversational bombs there. Enjoy yourselves.
Absolutely, and there's quite a few things there, but look, when you look at flooding in Mauritius as well, you know, it's all over the world. There's going to be climate displacement. So, David, I will bring you into this, but Suhaib, I just wanted to ask you one question here. As an international student, then, how's good health and well-being viewed back home in Pakistan?
Yeah, so in terms of, you know, it's changing, I would say, like how it's being viewed. Like, you know, it was like, you know, in the past it's being like viewed in like, you know, as a negative thing, like, you know, like someone having their mental health disturbed was a negative thing. And then there's a notion like, you know, this specific person is mad, you know, because, you know, so I think so, but it's changing, you know, because times are changing. There's a lot more awareness now, I would say, in people, like in terms of mental health and why is it important. But with everything, you know, it still needs improvement in terms of, you know, government level. And like there's definitely a lot of things that we need to do. But of course, as any developing nation, as any developing country, we don't have the resources right now. And there are other issues that, you know, unfortunately, they take over the time. That, you know, there's so many other basic issues that needs to be resolved before coming to health, and which I think so health is also one of the basic issues as well, you know. But that's how some systems work, you know. So in generally, you know, there's a very positive attitude, like in terms of like, you know, taking mental health as serious as your physical health. You know, there's a lot more awareness in people, but of course, with everything, there still needs to be a lot of improvement. We need to like make normal, like, you know, people seeking help for mental health should be normalized. It has not normalized a lot more now, but I think so it still needs to be normalized. You know, and I think so a lot of support needs to be provided by the government in terms of, you know, like good well-being and stuff. but it takes time, with everything, unfortunately. But yeah, overall, I would say it's an improvement. But yeah, still a lot of work needs to be done.
I think that's one of the key themes, that resources is really essential here, and how to prove those resources. That's going to be a constant theme in any sort of situation. David, can I bring you into this conversation then? What strategies do you recommend for an individual looking to improve their self-image and boost their confidence? Because let's try and get a little bit of solutions in this discussion. We've had many, but
Okay, well, so I did pop a link into some self-compassion exercises, which I think might be worth trying. I think the theme today has been social connections. So building networks, building social supports, and when we talk about destigmatizing help seeking, getting away from the idea that people should be able to self-manage, and that's part of that resilience narrative that's coming out. It boils my blood to see the term resilience included in things like job descriptions, because it's not a personal quality or a trait. It's not something we have or we don't have. And when people try in a well-meaning way to help people build up their capacity to cope with adversity, I think they've inadvertently created this narrative that you need to be strong, you need to be bulletproof, rather than there are strategies you can build to help you cope with adversity. It doesn't take away the pain of the knocks of life. Social support, building social networks, understanding that problems is part of our common humanity. Coping with things that might seem a little bit trivial on the broad scale of things when we're talking about climate disasters are still things that that hurt us and deserve to be heard by others, so that we can help to resolve that.
And just out of interest, what common taboos do you think there are that often come up? Lisa, actually, please interject, actually.
Sorry, I've raised my hand. There was just so much that's been said and so eloquently about the importance of destigmatizing help seeking, and I couldn't agree more. I think another important thing to highlight is that we need to normalize help giving as well. It's not just about seeking help. I mean, particularly, I said I work in suicide prevention, so at the kind of more difficult, complex, if you want, challenging end of the well-being spectrum, of people who sometimes have sought help and it hasn't worked for them, or they're not well enough to seek help. And I think we just can't be reliant on people seeking help when they're in need, because sometimes they can't, they're not capable of, or the help they've received isn't good enough. And I think it's really important that we have a culture, and that part of those important connections we've been talking about today are about help giving. I mean, I'm an ambassador for the Small Talk Saves Lives campaign from Samaritans, that's been running now for 7 years, which is actually, and it's a very simple message of, at the right time, if you see somebody who's in distress, you don't have, we're not qualified necessarily to sort of have conversations with people about suicidal thoughts, when they're at a time of crisis, but we are all qualified and able to make some small talk. And sometimes that small talk at the right time in the right place can make a huge difference. I mean, we've done some research, and there were people sort of in locations where they had access to lethal means of suicide, and at the last minute somebody just smiled at them, and it made a huge difference. And we know suicidal thoughts are temporary, so sometimes just even a bit of small talk at the right time can save a life. So help giving is as important, sometimes I'd say even more important than having a culture of help seeking. Because of what we've said already, the making sure that we, some of the unintended consequences of the help seeking, the resilience talk, is that it's putting too much pressure on the individual to be resilient and strong and able to cope with things, or always able to seek help.
I'm just going to jump in there, because I just want to add to what Lisa said, because actually help giving is is building one's own well-being. And there's loads of evidence that suggests that being a giver of compassion and kindness is as good for your well-being as being a receiver of those things. So and I think that's what I had in mind when I talked about kindness at the start. Building kind and compassionate communities are communities that enhance their own well-being with individuals working in service of each other. So reaching out to support others, you know, even people who you might describe as wounded healers are building their own well-being through building those social connections. So simple things like volunteering in your local community to do, you know, work in support of others. It could be, you know, building gardens and making the place nice. It could be supporting people who are vulnerable or less fortunate. Loads of opportunities to make social connections, contribute to the well-being of others, and thereby build your own well-being.
Brilliant.
There was a big
Right, Lisa.
report recently looking at various well-being initiatives in the workplace specifically, and they did a systematic review and looked side by side at interventions that, I don't know, brought yoga and meditation in the workplace, and mindfulness, and volunteering was by far the most effective in terms of improving workplace well-being. So yeah, absolutely.
I can't see it in the chat, but Natalie did have a question for you, Nicky. I don't know if you've seen it, but can you read, are you aware of it? Can you answer that question? And ask what the question is, and can you answer it, please?
Both of those things, yes. I can do both of those things. So Natalie has put in a really great question, talking about the importance of staff being able to help students, particularly with anxiety, and actually saying that supporting people with anxiety, for example, is a skill that could be a mandatory professional development workshop for staff to help students better. Talking about the rationale of campaigns like this. And I would say there's a lot of really interesting things, but I would say we used to do a thing in health, which was whenever we saw somebody who may be, for example, an infection risk or something like that, so we'd make this big deal of going, washing our hands and putting some gloves on and then coming back. And then we'd wear gloves for some people who needed special attention. And then we stopped doing that. And we just wore gloves for everybody, because you create an environment that suits the majority of people. And I would say with sort of like picking and choosing different types of teaching or types of intervention, there's a point to it, but you then have to be able to assess everybody and get it right. Why not do what Middlesex is always trying to do, which is to create a learning environment that has enough flexibility in it so that nobody is made anxious or fearful by what should really be a joy and a privilege of learning. So I think absolutely there are in any walk of life, there are staff who are better equipped to deal with people in mental distress than others. And that can be any organization and any community. But I think we should all have a basic empathy and support and enough capacity in ourselves to be able to support other people in that kind of open-hearted way, and know that if something you're doing in a classroom is making people unhappy or frightened or scared or anxious, that's not our job. It's not our job to do that. And by the very nature of the way that education's history has been, particularly I would say in universities, with the kind of hyper-competitive, individualistic, the way that exams have been set up in the past, I think that does cause unnecessary anxiety. And the whole point of an education, I think, at a university for me, is about personal development for individuals and flourishing. So certainly you get a degree and you're fit for a job if that's what you're trying to accomplish, or you're fit to learn and think in a different way if that's what your purpose is. We don't need to cause harm to do that. So I think with flexibility and choice in curriculums, which is something we're always striving to do, and we do have, as Lisa was pointing out, changes in our education system coming up soon, there will be ways, hopefully, that we can work in that kind of diversity of learning need that we have, because we all learn differently. And to point at some people and say they have a need, like, no, we all have needs. We all have needs and ways that suit us better. And if we have flexibility and support, then we should all flourish. likewise, when you've got a staff group, that staff group, if you're expecting them to give support and encouragement and to be able to facilitate emotional development, they need to have that done for them before they can do it for other people. And that's a great mistake, I think, that sort of corporate thinking sometimes has, exactly as David was saying. They put, I want to employ a resilient person. Why don't you make a workplace that supports people to be resilient?
Yeah.
Like, don't work someone 70 hours and then say, why aren't you resilient? It said on the job format we needed resilience, and here you are, broken. This seems weird. Like, there's something about, you know, you can't draw on an empty bucket. We need to be sort of creating capacity at all places in the system. And I also think that when staff are under pressure, they're going to struggle sometimes to take on board what they might see as an extra role, you know, and this idea that you can also have mission creep. So, you know, sometimes the purpose of somebody is to educate, not to offer therapy. That's therapist's job. So there is something around how we make education fit for purpose, but also so that it's something that actually encourages flourishing. I think, David, you're wanting to say something.
Oh, well, yeah, I just wanted to agree with you, Nicky. And I just, the one bit I wanted to highlight is I'd like us to get away from the idea that thinking it's a special skill to support students with anxiety or distress, because I think that actually puts people off the idea that they might reach out and offer that help. Whereas allowing students, or indeed anyone, to be heard, to say what they feel, and responding with kindness is the key there. There's no magic formula, and as Nicky said, we don't want to turn lecturers into therapists, but we do want to build capacity for kindness. And I think the key to that is just, I suppose, mental health awareness. So things that can look in a classroom like disengagement or disruption or running away are actually things that we would want to treat with kindness.
Okay, I know everyone, we're into overtime. So but this has been probably about the best panel I've ever been part of. So I thank each of the panel. I do want to end on a somber note. Each of the panel, I want to ask you one quick question. What are the major challenges we're facing in terms of achieving good health and well-being? So, Lisa, can you have a concluding statement on that?
Well, Nicky put it so beautifully. I think it's poverty, which isn't an easy one to address, but I certainly think that's a big priority. And you know, with it, there's lots that we can do in the sort of immediate and everything else, but there is a bigger picture, and social and economic inequalities are, I think, very much in that big picture. So that I see as the big. I agree with Nicky. That's a big challenge.
Nicky,
something to be vocal about.
I don't think anyone ever agreed with me as much in my whole life. I just want to stay on this panel forever. It's so nice.
Come on, Nicky, add something though to it.
What do I think? I think that people need to learn to find their power. That's what I think.
I love that.
And stop taking it. There was a song like in the 70s, we're not going to take it. And since then, we've continued to take it a lot. We need to stop. You know what you need to live well. You know what you need your education and your home life and your work life to look like. Band with other people, because you can't do this by yourself. However that needs to happen, whether you're doing it in a faith group, a community group, a union, it doesn't make any difference. Find out what matters to you. Find other people who think the same thing and get together and make it different, because people don't give us anything. You need to take it sometimes. And I don't mean like snatch it, I mean politely insist. I'm not calling for revolution today on a Monday in January, because you know how I feel about January, but I am thinking that we're not hopeless, we're not helpless. We know what is needed to happen, and we need to start co-producing some change.
Suhaib, over to you.
Yeah. So austerity is one of the major challenges, because in terms of healthcare, we all can see what is current situation with strikes and stuff. So I think so. One is that austerity, and secondly, I think so. Once we normalize stuff, like we shouldn't have normalized food banks in a country which is like the fifth or the sixth richest country in the world. You expect food banks, or in a developing country, yes, but in a first world country when I came here, I was like surprised, like, okay, one can expect to have food banks in a developing country which is not that rich, but a country as rich as UK, there shouldn't be food banks. And I think so, unfortunately, you know, that food banks have been normalized. And, you see every year the number of food banks have increased, in like the last 2-3 years since the cost of living crisis. The food banks have increased dramatically. So I think so normalizing, stuff like that also does possess a risk for anyone or for any country to get the top. So I think so firstly austerity, that's one of the number one reasons that things are happening what are happening in UK in terms in the healthcare sector. And secondly, I think so we should stop normalizing things that are not right, in terms of food banks, in terms of strikes. So yeah.
All right, David, over to you.
I always get to go last when
Yeah.
people have said all the important stuff. So I suppose the only thing I have to add to the excellent points that my fellow panelists have made is that I think perhaps we should stop seeing these things as choices and often seen as expensive choices. We should think about what we get, what we gain from building a society founded on human decency, and not worry so much about the cost.
I'm going to add one in to the mix. So I think the biggest challenge we're facing is listening. Because I think often we don't listen to each other. When I look at this panel, it's been an amazing panel. So the details are there to everyone. So please, feel free to get in touch. It's been a really amazing panel. I want to put a special thanks to Christiana Rose as well, who helped set this up, and put all this together. But I think the one thing is, concluding thought is that we need to work together and continue that discussion. Yes, we've had discussion today, but how are we going to continue this afterwards? So hopefully that's been really insightful, and thank you to an amazing panel. You've been awesome, and I've been starstruck a bit to the answers given today, and it's been a pleasure and an honour to take part. Everyone have a good week, and it's time to talk this week. So let's continue that, and hopefully we'll have a bit more courage to talk up. Have a wonderful week. Over and out for me, Rabin. Take care.
Thanks,
you.
Robin.
Bye.
Thanks, everyone. Bye-bye.
Bye.